Thank you everyone for joining on. I'm just gonna keep admitting people. And we'll go ahead and start to share our slides while we hear from Suzanne Greenberg from Children Trust Michigan.
Well, I'll say good afternoon to all the Michiganders here. We have some of our guests that are not from this area, but we are in lunchtime, and I am so grateful. We, the Children Trust Michigan team, are so thankful that you're here and for your commitment to our infants, our children, and our families. The information you're going to receive is so important, and for some of you, it'll be an affirmation of things that you know and that you've been doing, and others it could be new. And so I want to start real quick with some housekeeping. We are recording this because many folks have signed up but may not be able to be here right now. And so we also ask that you keep your cameras off and keep your microphones off. And when you have questions, please put them in the chat. They'll be answered throughout, but also we may have time for them to be answered verbally at the end. We are really thrilled that this year, one of our focuses for Children Trust Michigan is the topic of prevention of abusive head trauma in our infants. We're also focusing this year on family resource centers and child sexual abuse prevention education. In fact, this year during our auction on May 19th, we are going to be raising money through our mission moment to expand the Purple program into our communities through our prevention partners. So today I'm very excited with this that we have this presentation offered to our prevention network as well as our statewide partners. And you'll be hearing today from our prevention program manager, Heidi Coggins, two of our amazing prevention partners. And last but not least, we are absolutely thrilled to partner with the National Center for Shaken Baby Syndrome. And today we have the program director for Purple, Chantal Wakely, who is here as our resident expert and partner on the period of Purple crying. Thank you so much for being with us, Chantal, and we know we're going to have just a great hour with you. So thanks for your time. We appreciate it.
Yes, thank you, Suzanne. I'm so excited to be here with all of you today and discuss the Period of Purple Crying program and how we can all better serve Michigan families. So I'm going to, I think you guys can all see my slides, hopefully. Let's go ahead and get started. So I did want to tell you a little bit more about the National Center on Shaken Baby Syndrome. So we are a nonprofit. We were founded in the year 2000 and we're based in Farmington, Utah. So yep, that's a good morning from me, but a good afternoon to all of you guys. And while we are based in Utah, we do serve organizations all over the world. We provide education and resources to organizations who are aligned with our goals to keep babies safe. We're the leaders in research-based development of abusive head trauma prevention programs, training courses, and public education campaigns. We host international conferences every other year. And actually our next upcoming conference is going to be in September in Nashville, Tennessee. So if you are interested in attending, we have presenters from all over the world who discuss family and victim support, investigative techniques, legal and trial experiences, prevention, and the latest research from experts in the field. So we'll drop a link to the conference page in the chat. And just a reminder, please turn off all your microphones so we don't have that background. So on a day-to-day basis, we host materials and training for school-based education, child care providers, caregivers, and resources for victims, survivors, and their families. But the largest program we provide is the Period of Purple Crying. It's the world's largest shaken baby syndrome and abusive head trauma prevention program. It's research and evidence-based and prepares parents with the knowledge and skills to help themselves and their babies safely reach those first-year milestones. So Purple takes an educational approach to supporting families rather than using fear-based tactics like we see in most shaken baby syndrome prevention programs. And the program is based on three critical lines of evidence. The first is that shaking an infant is dangerous. Second, increased infant crying is normal. And lastly, caregiver frustration with increased infant crying is the number one trigger for shaking events. So to understand how to prevent shaken baby syndrome and abusive head trauma, we first have to understand what it is. So the Centers for Disease Control and Prevention defines shaken baby syndrome as a preventable, severe form of physical child abuse, resulting from violently shaking an infant by the shoulders, arms, or legs, and may result from both shaking alone or from shaking with impact. And because it can be caused by both shaking alone or with impact, the term abusive head trauma is actually used more inclusively. So I'm going to be using both terms interchangeably throughout the remainder of my slides. So we know abusive head trauma is devastating, but just how common is it? Approximately 1,200 to 1,400 clinically recognized cases occur each year in the United States alone. So that's around 32 to 38 cases per 100,000 children less than 1 year old suffer from abusive head trauma each year. But because 30 to 40% of cases are missed at medical institutions, the actual incidence is unknown despite the prior estimations, and it's likely that the known incidence is just the tip of the iceberg of the amount of cases occurring each year. And unfortunately, the outcomes for infants who are taken to hospitals are poor. In published studies, as many as 10 to 20% of babies die as a result of shaking. And of those who survive, 65 to 80% have significant long-term neurological and developmental abnormalities. So how do we know that increased infant crying is normal? So some of you may be thinking right now, well, infants cry, duh, I know that, we all know that. But there's been over 60 years of research done on infant crying. And over the years, it has shown that infants cry, but they cry a lot more than most expecting parents and even the general population would think. So our understanding of the normality of early increased infant crying started with a study by T. Barry Brazelton. So Dr. Brazelton asked mothers of healthy newborns from his practice to take home diaries and record all the fussing and crying their infants did each day for 3 months. And from his published article in 1962, the crying curve was born. So there's two important things to notice from this crying curve. First, there is a very clear increase and then decrease in the number of hours of crying and fussing. The onset is at around 2 weeks of age. The peak is during the second month, and it slowly decreases after that. Second thing to notice is just like weight and height, there's a very large infant to infant variability in the amount of crying that the infants experienced. So what you can see in the shaded purple area represents about 50% of all the infants in the study. So it means that 25% of these normal babies cried less than is shown in the lower line of the shaded area, and 25% cried more. So even though some babies cried less while others cried more, they all went through an increase, peak, and then decrease in uncontrollable crying behaviors. And so it just provided the information that this is something that all healthy infants experience. So whether the babies were born pre or full term, and despite the vast differences in caregiving behaviors and even species, all the subjects studied showed an age-related crying or distress pattern. So that just shows that increased infant crying is normal in all healthy infants. So wanting to see if crying was a significant trigger for abusive head trauma, they hypothesized that the amount of cases should follow the curvature of the crying curve. So this figure demonstrates that their hypothesis was correct. It was a study conducted on publicly reported abusive head trauma cases, and it showed that when plotting the 591 cases by age, which is the top purple line, the shape of the curve is very similar to the crying curve, with the majority of abusive head trauma cases around that 2-month time frame. So it's strong evidence to show that they could be related, but there was no direct information showing that the crying was in fact the stimulus for the shaking. So they then turned to the 166 cases that mentioned frustration with crying as the specific trigger for the shaking event, which is the bottom blue line. So as you can see, both are very similar to the crying curve, with the peak amount of cases happening around that 2-month time frame when an infant's crying is also peaking. So these studies provided direct evidence showing that crying is the most important stimulus for shaken baby syndrome and abusive head trauma cases. So from various studies, we know that abusive head trauma is the only form of child maltreatment where we know the specific trigger and timing of the incident, which means it can be prevented. And prevention really starts with educating parents and caregivers about normal infant crying and the frustration this crying can cause. So that's where the Period of Purple Crying program comes in. The program has two aims. First, to support caregivers in their understanding of early increased infant crying and to reduce incidences of abusive head trauma. So what does the program look like? So these are the materials that the families receive with the Period of Purple Crying program. It comes in an app and booklet package. It contains a 10-page booklet, a unique one-time app activation code, and a parent reminder card. So when delivering the materials to families, they're encouraged to download the app, set up an account by entering in the code, and choosing a login method for future use. So they can also invite up to 5 other caregivers of their baby to access their baby's profile on their own devices just by a click of a button. So this includes their partner, babysitters, grandma, grandpa, really anyone who would be caring for their baby can have access to this app and to its information. So the mobile app is currently translated into English and Spanish with closed captioning available. And while the mobile app is only in those 2 languages, the booklet is additionally translated into French, Arabic, Haitian Creole, Somali, and some more to come soon. Now, one of the main components of the program is the PURPLE acronym. So the reason the program is called PURPLE is that each letter stands for one of the 6 features of crying in normal infants that contribute to the frustration and anger that caregivers experience. So the first P stands for peak of crying, which we saw in all those crying studies where their peak amount of crying happens during that 2nd month of life. U stands for unexpected, just referring to the fact that the crying bouts can begin or end completely unpredictably and have nothing related to anything going on in the baby's environment. So the crying isn't related to dirty diapers, feeding, gas, or anything like that. R stands for resist soothing. When nothing a caregiver tries can calm the baby down. The second P stands for pain-like face, when the infant looks like it's in pain, even when it's not. L stands for the fact that these bouts are long lasting. They can average about 35 minutes per bout, lasting up to 5 hours a day or more. And the last letter E stands for the fact that the crying tends to cluster in the late afternoon and evening hours, often when the caregivers themselves are most tired and frustrated. We then preface the acronym with the word period, just to remind caregivers that the crying does not go on forever, but only for a particular time period in the infant's life. So the purpose of the PURPLE acronym is to provide a quick, memorable, and easy way for caregivers to recognize and acknowledge that these crying characteristics can happen and they're completely normal. Another component of the program is the crying curve. So while the acronym prepares the parents for the crying characteristics, the crying curve prepares them for the timeline. It's great for caregivers to understand that the crying starts to increase at 2 weeks. They experience a peak at 2 months and slowly decreases after that. It's very important for them to know that the crying will come to an end. So some other content available within the app, we have tons of exciting features. Some of the videos we provide is our Period of Purple Crying video. It's a parent testimonial. It has real life parents who experienced high crying babies and what they experienced. We have our Crying, Soothing, and Coping, Doing What Comes Naturally video, a digital copy of the physical booklet they receive, and content sections with videos and articles on various topics like crying characteristics, soothing techniques, coping methods, safe sleep recommendations and best practices, infant safety, and even self-care strategies for parents. We also have the baby developmental tracker feature within the app. It allows parents to track feeding, crying, sleeping, diaper changes, breastfeeding, pumping, measurements, and even vaccinations of their baby all in one place. It then lays out the data in graphs that allows the parents to see their infant's growth and change over time. The dad's handout is a semi-new supplemental material created to be in partnership with the Period of Purple Crying program. It's not required to be utilized to participate in Purple, but it is available. The handout is to be given directly to the father figure to help engage them in the education, as well as provide them with important information about the attachment with their baby. It also directs the father back to the app to encourage them to review the articles and videos that can be applicable to him. And the main reason the card was made was because a study focused on perpetrators of shaking events found that fathers are the most common perpetrator of abusive head trauma, with parent partners second and mothers third. However, we know anyone is capable of shaking a baby because anyone is capable of becoming frustrated. A study in 2022 showed that children under 1 year of age with siblings under the age of 5 are more likely to be injured by their biological parents. So this demonstrates the importance of all caregivers, not just the mothers, being engaged in prevention education. And even if they've had a baby before, this information is not only for new parents, but anyone who is caring for a child under 1 year of age. So the delivery of the program has been studied for over 18 years and has shown to be very effective. In 2009, 2 randomized controlled trials showed a change in knowledge and behavior related to abusive head trauma prevention with Purple. In 2013, a study conducted in North Carolina found that parents reporting shaking as a form of discipline was reduced by 50%. And in 2015, Purple was found to decrease emergency department visits for complaints of crying unrelated to physical illness by 29%. This reduction in emergency department visits actually led to a hospital cost savings of roughly 18%. And in 2018, one of the most important studies supporting the program was published. It was an 8-year outcome of implementation study. It revealed the Purple program was associated with a 35% reduction in abusive head trauma cases in children under 2 years old. Following that, a cost effectiveness study was published. It found that every dollar spent on Purple had an associated $54 savings by society. A study conducted in 21 on a population of Hispanic mothers found that their knowledge of normal infant crying patterns was improved through the delivery of Purple. And one of our latest studies in December of 23 found that hospitalization rates for physical abuse in children under 2 years of age decreased by 30% in British Columbia after Purple was universally implemented. If you are interested in looking at any of our research on Purple or just general abusive head trauma, our don'tshake.org website hosts plenty of studies for you to view, and we'll drop a link to that website in the chat as well. Another study conducted on home visiting programs and components of that produce positive impacts on their effectiveness showed that the 3 most significant components are focus on improving parental expectations of the child and parenthood in general, targeting parental responsiveness or sensitivity to a child's needs, and video-based feedback. And the Period of Purple Crying program involves all 3 of those components that improve a home visiting program's effectiveness. And the great thing about the program is anyone who serves families with infants under 1 year old can utilize it. There's a wide range of professionals who come in contact with newborn families. And by taking a multifaceted approach, we can ensure these families in Michigan are receiving this critical information. So the delivery model of this education has been studied for over 18 years, and it's found that the most ideal delivery is through 3-dose exposure approach. And the best part is the program can effectively be delivered in as little as 3 minutes. So dose 1 is directed at teaching parents and caregivers before the infant reaches that 2 weeks of age, before the infant starts crying, naturally starts to increase. In dose one, parents receive the Period Purple Crying Program app and booklet, typically by hospital discharge, prenatal classes, home visiting, just some for an example. Dose two is more of a reinforcement approach. Since the parents have already received their app and booklet, you just go through the key components of the program, reinforcing those messages. Home visiting, well baby visits, and other family programs are a great fit for dose two. And then dose three is just all efforts to reach the general population. So social media, billboards, flyers, anything like that. So some people may not be sure if you're dose one or dose two. The easiest answer is you could be both. So if you work at a birthing hospital, you would typically be dose one, but sometimes the program could be utilized in a prenatal class. So you would then be dose two or reinforcement. Another example is you could be a home visitor or community educator that doesn't see families until the infant's a couple of months old. So you would typically be dose two, but sometimes people get missed at hospitals or organizations who may not be doing the program. So then you would become dose one. Really, the only way to find out what dose you are is to give them, is to ask them what they have received or not. If they've received the app and booklet, you proceed with dose two. If they have not, you proceed with dose one. So how do you start implementing the Period of Purple Crying program? So the first step to implementation is to get trained through our online website via our 1 hour free training. So this training goes over the research supporting the program, as well as how to deliver the information to families in more depth. We'll drop a link in the chat if you want to view the training site. Also, if you are a nurse or social worker, this training qualifies for 1 hour of continuing education and it's free. The next steps are just understanding our implementation protocol. We have documents that walk you through how to deliver Purple and lays out the obligations of you delivering the program, signing our fidelity agreements, and then the last step is purchasing the program. So the program does have a cost. It is $2.50 per copy, or essentially $2.50 per each family that you serve. And some of you may be thinking, this is great information, but why do we have to buy the program? Why can't we just talk about the acronym or show the crying curve? So that's because not only is the program model research and evidence-based, but the use of these materials were tested in an 8-year study, and it found that both mothers and fathers were found to increase the use of these materials during that high crying period at home, which is around that 2 months after delivery. So mothers using the materials more than doubled at home post-discharge, and 50% of fathers had read and viewed the materials by that 2-month mark. So that's why it's extremely important parents and caregivers have their own set of materials at home with them so they can review the information later, as well as share it with other caregivers of their baby. And I did want to touch on misuse of the program. So the Period of Purple Crying can only be delivered to families as the app and booklet package. If you are not delivering the app and booklet and only talking about Purple, showing a flyer, showing a website, that is unfortunately a violation of the fidelity and copyright of the program and can actually diminish and water down our research on the program's effectiveness. So the program has to be delivered to families according to our implementation protocol. So please help us keep this program effective through our fidelity model. And I wanted to end on cost benefits of prevention. So although programs and prevention have a cost, it has shown to be very cost effective. So large financial costs are associated with this form of abuse. Even a mildly effective case costs over $1 million. One major benefit to implementing Purple is it actually shows potential cost savings to the medical system and to society. So to help with your understanding of the cost of abusive head trauma, this graphic is specific to Michigan. So the red line shows the average lifetime cost of a surviving abusive head trauma victim. It costs well over $2 million to society. The gray line shows the cost of medical care for one severely injured victim from 2 months of age to 17 years. It's around $260,000, which half of that was paid out of pocket by the family in the studies. And the purple line now shows the cost to provide Purple program materials to every family with a newborn in Michigan. And as you can see, preventing just one abusive head trauma case pays for prevention and is actually very cost effective. So in summary, the Period of Purple Crying program is linked to a 35% reduction in abusive head trauma cases, a 30% reduction in general infant abuse cases, and can be effectively delivered in less than 3 minutes. And I just want to end by saying that prevention is possible. There is power in prevention. And thank you all for the amazing work that you do to support Michigan families. And here's my contact information. We'll enter the contact information into the chat along with our general purple email for any questions or any follow-ups. And we're going to go ahead and transition over to some of Michigan's local implementers. So I'm excited to introduce you to Allison Land. She's the coalition team lead at Arbor Circle, and Kelly Haney, the director of program innovations at Child and Family Charities. I'm just I'll let you guys figure out how you want to do it. But Allison, if you want to start just briefly describing how you utilize Purple.
Yeah, absolutely. I'd be happy to do that. So hi, like Chantel said, my name is Allie Land, and I am the coalition team lead at Arbor Circle, which means that I help to coordinate our Stop Child Abuse and Neglect Council here in Ottawa County. And so what we do to implement Purple is we are partnered with two hospitals in our community, both Holland Hospital and then Cornwall, Zealand. And we purchase the materials as like the leading agency or leading group for this for those hospitals, and we make sure that they get the training that they need. So these two hospitals, we started with just the one. We started with just Zealand. Gosh, I don't even know. It was before my time. I've been here for almost 5 years. So we started with just Zealand before my time, and then worked to get the other major birthing hospital in the community on board as well. And then we also, sitting on our SCAN council is our MIHP team, Maternal Infant Health Program team. And so they are able to implement dose 1 or dose 2, potentially depending on the family, for us as well, or through us as well. So we handle about a total of, it's around 2,000 births per year between the two hospitals, which is like, the scope of that is amazing. And then we've also worked to get those fatherhood materials into the hands of fathers as well. And so with every app, we make sure we're partnering that fatherhood handout. Obviously, it's not going to be relevant in every situation, but as many of them as possible, we're getting that fatherhood handout into their hands too. This covers around, I would say, about half of our county. Some people go north to Muskegon, some people go east to Grand Rapids. So it just depends on where you're giving birth. And then we also offer the training. So that's really what we do for implementation of the Purple program.
Awesome. Okay. Kelly, if you want to talk about what you do at Child and Family Charities. Maybe she's having some technical difficulties. That's okay. So we'll just keep picking on Ellie. So I just have a question for you. So what are some parts of the Purple messaging that seem to resonate with some of the families that you serve through Arbor Circle?
Yeah, I think just the idea. So we really, one of the things that we really try to hit home is that this is a period, right? Like this is a period of time. And so, yes, the crying does potentially increase. And it can be very challenging. And so what I think really resonates is that like this is a period of time in that child's life, and things are going to get better. Things are going to get better. I think that's the major part of it. And then really hitting on that acronym as well, and just making sure that folks understand that Purple is an acronym, and that each piece of that kind of plays into what that crying might look like.
That's great. Can you think of any like common challenges to implementing the program that you maybe experienced, setting up the program, or as it's been at Arbor Circle for a few years, some things that you're seeing and how you have addressed them.
Yeah, so some of the kind of common challenges that we've had have really been so like, there's turnover in nursing staff, there's turnover in staffing in the hospitals or in the MIHP program, and really getting the training to those folks and getting them to have the time. They're just busy people, to show up, and so one of the ways that we've kind of overcome that is by, offering multiple trainings and then also being able to offer that database or I don't database is not the word I'm looking for, but the online kind of supplementary option to that as well, or the retraining too, if you will. So we're able to offer them, the credits too. So that's always important. Um, and then we're working right now on some cost sharing options because cost does become a bit of a barrier at some point just based on, and yes, we know it's worth it. We know that this program is amazing, and that it has done good things in our community. But the cost does become a barrier at some point. And so we're working on some cost sharing between both us as an agency and then the hospitals as well. So really trying to get them involved in like how can we share some of this because we know it benefits the families that we are serving.
Amazing. And I guess one last question for you would just be what advice would you give to organizations who are just getting started with Purple or wanting to learn how to do it in their own organization?
Yeah, I think the best thing you can do is really, reach out to people who have done it, reach out to people who have been there, and then really start to form some good community connections with the agencies that would be, really doing the implementation. So, um, when we do the purple crying trainings, we do them for the community. Anybody who wants to come can come. It doesn't necessarily have to be somebody who works at the hospital. So really starting to get that word out and then have your data, know your community level data. So that was one of the reasons that we were really able to get into the hospitals is we had a small spike in abusive head trauma cases. And we had that data from the health department and we knew it. And so we were able to really have that conversation about how this could be beneficial in our community.
Awesome. Thank you so much, Ali, for joining us today and being here and representing Arbor Circle. We're so happy for our partnership with you and your advocacy of Purple.
Yeah.
Is I'm sorry, I can't see everybody, but is Kelly Haney or is she still on?
I'm here. Can you hear me now?
Amazing. Yes, yes.
Yay.
Awesome. Okay, we'll just kind of do the same thing with you, kind of ask similar questions if you want to just kick us off with how Purple looks at your organization.
Yeah. My name is, of course, Kelly Haney, Director of Program Innovations at Child and Family Charities. So we're located in Lansing. And I actually started at the agency like 15 years ago as an intern at Angel House, which was a residential facility at the time for teen moms in foster care. So I was actually first introduced to this while working there. And now I oversee our Family Growth and Resource Center, which trains this intervention. So it's been nice because I've been able to see kind of both sides of it. And so when I was at Angel House, like I said, it was a facility for teen moms, and they were all in foster care. So as you can imagine, many of them um, did not have the tools for like basic parenting, if you will, let alone knowing these little kind of like I consider this like a specialized area of parenting because I mean it's not talked about a lot. Everybody, like says, knows that babies cry, but and that's what we would tell the girls. I mean, they just cry. That's just what happens. And if you get frustrated, hand them over to a staff, and we'll help you to kind of prevent that. But having Period had gives us the framework to talk with the clients and with the teenagers about,
hang it
you
up.
know, about about babies crying and why they cry, and that maybe they cry for no reason. And so we still have Angel House. It's an independent living program for teens in foster care. So they do still have moms there. So we do still use the program over at Angel House, but we train it out of our Family Growth and Resource Center. So we provide safe sleep training to our clients or to the community. We advertise it to the whole community, and then we partner period with Safe Sleep. So we train both of them at the same time in the same session. And then a lot of our clients that come to those trainings are clients of our resource center. So we kind of see them on a monthly basis or a regular-ish basis. And we also do nurturing parenting programs. So we see a lot of them in that program as well. So we're able to like follow up with them and kind of do that second like reinforce piece, as we see them in different areas of the agency and programs.
That's great. Yeah. Thank you for elaborating on, how it all started, like where you were at before previously. It's always so interesting to see how people, hear about Purple, or they were with a past organization that did Purple. So that's great. So I know you talked about safe sleep, and as we know, safe sleep and Purple kind of go hand in hand, just because the timing of delivery to Purple is around the same time. So with Safe Sleep, what are some other Purple messages or components of the program that you feel resonate the most with the families that you serve?
Well, I think the thing that's most shocking to our families is when we tell them that this is normal, like this is a normal part of development, and that babies sometimes cry for what seems like no reason. Um, and so I think that's like the biggest piece that resonates with our families, and that's most shocking. And that's like an easy kind of bridge for like sometimes I'll be talking to parents and they tell me they're frustrated because their babies cry so much. And I will say to them, that's normal. And we can help train you in, like how to live through this little experience or this period of child development. And then we offer them up the safe sleep with the period of Purple crying. And so period goes hand in hand with safe sleep because it's part of safe sleep. I mean, a lot of times like in the webinar that you just showed, it's happens late at night or in the evening. And then, partnering that with like making sure you have a safe sleep environment for the babies. If they need to lay that baby down in that safe sleep environment while they're crying so they can step away and like calm themselves down, we've kind of set it up so that that's pretty seamless. Instead of, having to worry about like, where do I put them? That's a safe place while they're crying and I need to just take a breath.
Amazing. All right. And so just one last question for you, Kelly. What advice would you give to organizations that are just getting started with implementing Purple or are looking to?
Um, I think we've found a lot of success kind of pairing it with that safe sleep also. So being able to offer it in many different kind of contexts, like now sitting here, I mean, hearing Allie partnering with hospitals, like I think that is amazing. And now she's got my wheels turning as like, how can we scaffold this and get it out to more than just the people that come into the agency? But I think just, like I said, partnering it with other things, and then also kind of making it, I guess like a well-known training across the staff members that serve these clients, so they're all speaking the same language, and they again can kind of reinforce that after the clients have gotten that training.
Awesome. Thank you so much for your insight, Kelly, and for joining us today.
Yeah,
I'm so glad for your partnership. And once again, thank you for joining us today. It's great
no
hearing from both
problem.
you and Allie.
Thanks.
Okay. Awesome. We're going to transition now over to Heidi Coggins. She is the Prevention Program Manager at Children Trust Michigan, and we'll transition over to her.
Welcome, everyone. I am beyond excited to see all of you today and potentially giving up your lunch or eating while you're listening. So thank you so much for being here for such a important message and training. And I hope that you will take this to share with all those that you know and might benefit from this and other programs. I just wanted to take just a few minutes of the webinar today to just share a little bit about Children Trust Michigan, but how this aligns with our mission and vision and why we find this really important, and to share a little bit more Michigan data that demonstrates the importance of abusive head trauma prevention, and that PPC is just one way to help do that. And so our mission, here at Children Trust Michigan is to provide financial support, education, and resources to our network of partners throughout Michigan that help prevent child abuse and neglect by strengthening families. And so this really aligns with our mission, but it also aligns strongly with our vision here at Children Trust Michigan as well. We here thrive to believe that in Michigan where every child is happy, supported, and has access to a bright, safe future. And one way, we all know that starts early. And so getting this information out into the hands of educators and hospitals and doctors and families is just really important to really strive for this vision of having, children where they grow up to be safe and happy and supported. Here at Children Trust Michigan, we are the state lead for child abuse and neglect prevention appointed by the governor. We are also the state chapter for Prevent Child Abuse America. We are a member of the National Children's Trust Fund Alliance and also a member of the National Family Support Network that helps support our family resource centers here in Michigan. An important strategy, we just really stand behind the Period of Purple Crying. We've been doing this for many years at Children Trust Michigan. We've been a longstanding partner of the National Center for Shaken Baby Syndrome, probably at least 10 years, maybe longer to my knowledge. And I just think it's really critical that, Period of Purple Crying, and reducing shaken baby syndrome and abusive head trauma is just really important. So we wanted to re-elevate and get this energized and just get it out across the community here in Michigan again to help recommit to the education and building partnership with local organizations to deliver prevention education such as Period of Purple Crying. And so we just think that this is really important, and we're really excited that you're here to help us spread that message in Michigan. In addition, though, I do want to tie this back to some data. We were able to work with an injury prevention epidemiologist here at Michigan Health and Human Services, because CTM is administratively housed here at MDHHS, and we had access to getting some data last year. So we haven't received any recent update. We did get this back in 2025, I believe. And I just wanted to share, Chantel shared some Michigan data, but, this is relevant, although this is traumatic brain injury deaths and hospitalizations and some emergency room visits for children 0 to 3. And it doesn't always specify, whether that was done through Shaken Baby, for sure, and how those were due, in looking more further into data to really determine that. But just more important, there was 142 deaths. We've had a lot of hospitalizations and increased emergency visits just around, brain injury. So I just really want to, elevate that. It is critical and important in Michigan here to be sure we get this information out to, everyone and anyone that's working with children, parents, that we can just make sure we're supporting and getting that information out as soon as possible. On the other slide, it's just a different way of seeing that same data, but you can see the consistency, hasn't really significantly dropped. So I think that, the more we can be advocates to share this information is just critical. I do also want to acknowledge that this data, you'll see where the ED visit data, there were some years, for reasons I'm unsure of, that data was unavailable in 2016, 17, and 2023. So that's why you're not seeing that here on this chart. And just lastly, Chantel spoke of things that you could do, and so did the local programs. Allie and Kelly also shared, things that they're doing. But what can you do if you're not in some of those situations? Is definitely sharing this with parents and caregivers. Whether you're doing baby showers, health fairs, if you're working with local hospitals, medical clinics, to get this information out, even maybe supporting some media campaigns in the community, partnering with those that are doing peer to purple crying. If you're able to help elevate that media campaign as well in your community, that would be great. Again, she talked about home visits. If folks are doing home visits, I know whether that's NIHP or parents as teachers. Somebody mentioned doulas. There's lots of opportunities to connect with parents that we can get this into the hands sooner than later is just really important on the timeline. Connecting with fatherhood programs. We have that fatherhood piece that Peer to Purple Crying has now created too. And she shared the data and the importance of really connecting fathers. So let's not forget the dads out there when we're thinking about connecting with parents. Again, birthing hospitals were mentioned, and just really help promoting the awareness of Peer to Purple Crying. And I just kind of wanted to tie that in and connect that with some Michigan data and supports and some next steps that maybe you could walk away with.
Thank you, Heidi. Yes, thank you for bringing it, full circle and focusing on specific Michigan data. And I think it is important just to remind all of you attending today that, get in contact with the Children Trust Michigan, get in contact with the National Center on Shaken Baby Syndrome. We're here to help support you and your prevention efforts in Michigan. We do have plenty of time. If anyone has any questions, please drop them in the chat feature. We'll just give it a minute. If there are none, we'll go ahead and wrap up and give you guys the rest of your lunch early. But please look in the chat for any emails or content links that we added. If you have any things that you want that way, you can also just email me and I can send you anything from today. We'll just give it like one more minute. Awesome. I think there might not be any questions. So we'll go ahead and just wrap up early. I want to thank Ali and Kelly and Heidi for presenting their information and just being very specific to Michigan and what we can do for families. I'm very excited to have shared this information with you all, and hopefully we can make Michigan a purple state. So thank you again, everyone, and have a good rest of your day.